A battle over nurses' right to organize at the prestigious Johns Hopkins Hospital in Baltimore resulted in a settlement last week when the sprawling institution agreed to post signs that says workers have a right to freely discuss joining a union at their workplace.
I think this is the agreement that you're speaking of. So back in 2018, October, we nurses, as well as National Nurses Union, filed unfair labor practice accusations against Johns Hopkins Hospital. In that period of time, their response was to continue to delay actual court proceedings. And in the end, Johns Hopkins decided not to continue to fight those charges, but to actually settle with us. So there's definitely merit to the fact that there were unfair labor practices. For what this means with this particular agreement and posting, now which the law already stated, but this just affirms what the law says, that we are able to actually have conversations at work, which that was being prevented by people who were pro or against union organizing. They were preventing other nurses with speaking with each other about organization, and also we were prevented from actually entering break rooms, which anyone can really go into a break room, especially any other colleague that works for the hospital, including family members and friends who actually visit nurses on their breaks as well. I'm Richard Jones. I work in the Johns Hopkins Hospital in the surgical intensive care unit. I've worked at Hopkins for about 21 years in that unit since 2009. We are organizing for a union for nurses at Johns Hopkins Hospital, and the reason why we're organizing is to be able to improve patient care and also improve patient nurse to patient ratios as well as we are organizing for fair compensation and benefits.
Hopkins Hospital response to this agreement was that they noted that in the agreement it says the agreement itself is not an admission of breaking labor law. That it says that in the agreement, and they say so by claiming the agreement shows that Hopkins is breaking labor law. That's a misrepresentation of what the agreement says. How do you respond to that?
Well, I just go back again to the facts. The facts are these, that unfair labor practices were filed against Johns Hopkins. Johns Hopkins' response was not to continue to fight against that response and go to court and prove that they did not actually participate in unfair labor practices. The National Labor Relations Board actually found that there were merit to the charges. So instead of actually fighting those charges in court, they decided to settle with us.
And I know there's some nurses that have launched, they've done their own sort of anti-union campaign.
The largest number of people who have tried to keep the union out of the break rooms and out of their units is the nurses themselves.
And so they say that, look, we don't need a union. We can negotiate with the hospital. Things are pretty good here, and we can make them better if we, as nurses without a union, sort of push management to do better. What's your response to that?
Most of my colleagues, so when I became a nurse at Hopkins and throughout the continuum, it has been touted that we are a true shared governance hospital, which means that colleagues like myself, not even dependent upon what level of nurse that you are, we all are part of the decision-making process, and that we have a democratic process to where we can actually make decisions to effect change. Well, the union, what it does, it actually gives us true shared governance where there is not just one person at the top or at some part of the hierarchical structure making a decision for several employees. It's all of us collectively coming together, making decisions for ourselves to empower ourselves. And as we empower ourselves, we actually prove our worth and we actually bring dignity back to our profession.
And so I know this campaign's been going on for a while. Do you think that this could help you? Because you need to talk about what you're aiming for in this campaign, what you need. You need to convince the other nurses to sign up, essentially. Do you think that this is going to help get you to the threshold you need for support among other nurses?
Yeah, the end goal, of course, is to win an election, and we've been gaining support even despite all of the millions of dollars have been poured into anti-busting against RNs, our right to collectively bargain. Have gained tremendous support, and as nurses are allowed to actually speak with each other and have conversations and be educated about the whole unionization process, whether you're for a union or not, or against a union, you should always be able to make an informed decision. We actually, as a nurse, we actually participate in the informed decision process on a daily basis with our patients when they're actually deciding to either be admitted to a hospital. They have to be informed of whether they can either want to stay at the hospital or actually leave the hospital, or for specific, if we're actually doing procedures and whatnot, we have to get informed decisions. So all we want is to what our patients actually receive on a daily basis is to have informed decision.
They released a scathing report that found that since 2009, Hopkins has filed more than 2,400 lawsuits seeking payment of medical debt. The report found Hopkins disproportionately sued residents of low-income Black neighborhoods in Baltimore, and argued that because Hopkins is a nonprofit that receives tens of millions annually in tax breaks, something like $164 million alone in tax exemptions in 2017, it should provide care to those who can't afford it. We contacted Johns Hopkins for a response, and this is what they sent us. They said, "Our mission is to improve the health of our community, and everything we do is to advance that goal. Our first priority is providing care. Those who have the ability to pay for their health services should do so. For those who cannot pay, we consider it our mission to make sure they receive the care they need."
Yeah. So there was a recent study concerning medical debt where certain populations in Baltimore and the patients that actually lived in certain zip codes were definitely targeted, and they were in collections with their medical debt, money that they actually owe the hospital. Well, Johns Hopkins also receives millions of dollars per year from state government taxes funding that actually is used to actually cover those certain instances. So if the hospital is actually suing these particular patients, it's hard to establish trust with them when we're actually caring for them. So, and therefore, if we're actually are able to provide adequate care and the best care for patients, they need to be able to trust their healthcare providers.
For a lot more analysis on this story, go to therealnews.com or click on the link below. This is Jessel Noor.